Hey, what's going on, everyone? Dr. Taylor, Spire Chiropractic. Today, I want to talk to you about migraines. Yay! All right, cool. So, what are migraines? What causes them? What can you do about them? Migraines can be tricky. There are, I'm going to pull this number straight out of the air, but let's say 85 to 90% of migraines are going to be caused by structural issues. Okay, so let's go over the structure real quick. If we've got our skull right here, we've got the very first bone in our neck. It literally, like, we're looking at you from behind here. It's a flat circular bone. If I take this thing out towards you and I turn it up like that, it looks like a ring with a couple of things coming off the side, right? And right in here, that's your spinal cord. So that's C1. And then we've got C2 through C7 are more or less just regular good old-fashioned bones. 2, 3, 4, 5, 6, 7, T1, blah, 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 right? Like that. Okay? They got the same little pieces coming off the side here like so. And they've got this little chunk going right down here. So these are called transverse processes. These are called spinous processes. Basically, process means chunk of bone. So we've got our skull. We've got C1, the atlas, the bone your skull sits on. And then we've got C2 through 7 going on down here. We've got our brain up top. That's our brain. Little smiley face there. We've got our spinal cord that comes out of our brain. In all reality, we're going to call this the brain stem. We're not quite in the spinal cord yet. Part of your brain literally goes down into your neck. C1, C2, some people as low as C3. Then it transitions into the spinal cord itself, okay? Now, why this is important is because every nerve in your body, more or less, comes off of your spinal cord, okay? So we've got nerves that come out here right between your skull and C1, C1, C2, 2 and 3, 3 and 4, 4 and 5, all the way down like that. So, really easy kind of rule of thumb, whatever's coming off your neck is going to go one of two places. Either A, up into your head, or B, down into your arms, hands, and fingers, okay? So if we've got a subluxation, if we've got a bone out of place, putting pressure, distress, dysfunction on a nerve, let's just take this C1, and let's say this thing is no longer horizontal like it's supposed to be. Let's say it's cranked over to the side. Back in the day, it used to be people talking like this. Now it's more people just, you can get this from lifting stuff, carrying things, doing everything with one side of your body, causing this C1 to have a tilt. Or if we're looking here from the top, causing it to move forward. And all of a sudden we're putting stress on the spinal cord like that. Or move backwards. Same thing, we can get it going side to side here. So what happens is that spinal cord is pressed on with that C1. What's that going to do? That's going to put pressure on those nerves, and the nerves in the top of the neck, where do we say they go? Boom, right up into the head. So you put pressure on those nerves that go up back into your skull. What are some symptoms that you could experience? Headaches, neck pain, migraines. So what do we got to do? We got to take the pressure. Let's do this one here because that's the one being pinched. Take the pressure off of that nerve. How do we do that? We realign C1. We restore that bone's normal position. Same thing can be said for C2 and C3. Those nerves also, boom, right back up into the head. So that's the neurological component of the migraine. We can also have a structural component. 1, 2, 3, 4, 5, 6, 7. So now we're getting down into, let's see here, cervical, from here down. We're getting into the thoracic spine. Now, why this is important? There is some bones down here, freaking bones everywhere. There's bones down here connected to muscles. There's one in particular, it's called your levator. And it goes from the corner of your shoulder blade, boom, right up into the base of your skull, right there. So we get issues in the lower neck or in the upper mid-back. That's going to cause that muscle to spasm up, and it will literally just start to pull on the base of that skull. If you've ever had those migraines or headaches, that you can literally feel them starting right back there, right by your shoulder blade. And as the day goes on, you feel that thing just creeping up until it's pulling right back here, and any sort of looking up or looking away from it, any rotation of the head and neck pulls on the base of your skull right there, and you feel that thing just creeping up on you all day long as you're waiting, like, oh, I got to get to the chiropractor because I feel this thing coming on. So what do we got to do? We adjust the bones of the back, specifically the lower neck or the upper thoracic spine. We get the function of this area of the spine moving and working well, takes the stress off of that muscle, takes the stress off of the base of the skull, and literally I've seen this happen thousands of times. Your migraine is gone before you even walk out the door. Last thing, and this is going to be more on you than it's going to be on me, it's going to be a chemical or an environmental component. There's a good chunk of migraines, that remaining 15 to 10% of migraines, that are caused by stuff out in your environment. Real common culprit, laundry detergent. Laundry detergent and or soaps, things like that, things that have kind of a, let's say, a noxious odor, can absolutely trigger a migraine. That's going to be that neurological component that your body is dealing with, taking stuff in from the outside in. So, not a whole lot that I can do from a chiropractic standpoint when it comes to choosing your laundry detergent, but it's literally going to be a guess and test kind of thing on your part. If you change your laundry detergent, if you got a new hand soap or a new, fabric softener, and now you start to get migraines, just think about that kind of stuff. Did you used to have migraines? No? What changed? Lastly, very, very uncommon thing. Did you get your hair cut recently? Did they wash your hair in the sink? Were you bent over, causing that whole thing in the back of your neck to get all pinched up and tight? That's going to affect the structural integrity of your neck. That's going to pinch on those nerves. So, check your laundry detergent, check your fabric softener, check your soap, check your hairdresser. Do you need a new style of haircut? Do you need a new routine at the salon? So, migraines, check C1, C2, because those are the nerves, boom, right up into the head. Check the stuff going on in your mid-back, because those are the muscles that attach to the base of your skull. Check the chemical stuff you put into your body and the environment that you're in, because those are triggers of different types of migraines. Now, if this sounds like something that's familiar or something that you're experiencing and something that you know, like, or trust is experiencing, send them right on in here. We'll do a thorough exam. We'll take some x-rays so we can actually see what that alignment looks like in the neck. We'll take a thorough history. Hey, have you gotten a new laundry detergent? Did you change your hairstyle? This stuff is important, because we're right here. We're ready to help you when you're ready to be your best. Right here at Aspire Chiropractic. Naturally.